To all those of you who have tuned in from wherever, on whichever digital line that you have been able to access us through, welcome. And I hope over the next 1 hour or so, the conversation that we'll have will be profitable to you as well as enjoyable to our participants on the panel. And I quickly run through their names. It's Mr. Manoj Saxena, who's the Managing Director at Zydus Pharma. And as I say your names, if you can just raise your hands, that'll be fine. The audience will know who you are. Dr. Prakriti Pradar, has she joined in? I don't see her on the screen as yet. Dr. Manjiri Bakre, founder and CEO of OncoStem Diagnostics. Mr. Abhishek Sharma, co-founder of GOQII. That's him there. And Ms. Pooja Bedi, actress and founder, Happy Soul. And I don't see her on screen as yet. If we may be waiting for them for a second or so. But that's fine. I mean, I have a message that says they are logging in. We will not waste our audience time or the panelists' precious moments. The framing for our hour's worth of conversation is very simple. And I'd like to capture it in this. A stitch in time saves 9. If we do things well in time, if you're able to anticipate events, or if you're able to understand where a particular trajectory is leading us to, and we're able to intervene early, we have a lot more of health in our hand than when we intervene later. And so therefore, I'd like to start with Dr. Manjiri. 2020, I think, has been a landmark divide in the way we will see healthcare. It'll be before 2020 and after 2020. And you're kind of in a space where you're uniquely looking at a lens where every individual needs to be provided this specific care that they deserve. Public health, of course, thinks in terms of the best care for the largest numbers of people at the lowest cost. You are saying that that paradigm can change in the world of precision medicine. How do you square the goals of precision medicine with the big idea that everybody should be healthy post 2020? Welcome.
Sure. Yes. Yeah. Thank you for this opportunity. It's a pleasure being on this panel. So how has, I mean, in short, you're asking how has COVID changed the way we work in times of pandemics, epidemics, using and role of precision medicine in it, right?
Yes.
Yeah. Okay. So let me just begin with briefly mentioning what is precision medicine. So, it's very clear to our audience. Let me share this slide, share screen, and then, yeah.
I'm not sure whether that may be possible, but just go ahead and explain to us. Yes, it's there.
Yes.
If you can full screen it, please.
Yes. Yeah.
Yes, thank you so much.
Yeah, so this is essentially what is precision medicine. So on the left-hand side of the slide, you see so this blue, yellow, light green, dark green, these are various patients. And without personalized medicine, they all are given one green tablet, and some of them benefit, some of them don't benefit, and some of them have even worse, which is adverse effects. So what precision medicine helps you in short is to understand each of these green, blue, light blue patients individually, understand their disease very well, whether it is cancer, it is heart disease, it is something else, and then treat each of these patients accordingly. So the green patients will only get the green tablet, and these patients will get some mixed tablets or different kinds of drugs, or the navy blue patient will get some different kind of drugs. So this is exactly what precision medicine helps you do by doing biomarker based diagnostics. They can be genomic, they can be proteomic, they could be radiological. So there can be multiple ways of doing this precision medicine. So this is essentially precision medicine, which is to explain, to help diagnose the disease in a lot of depth, so that you can treat the patient based on the tumor, based on the disease specifically. This is not to say that, for every patient we will come up with a new drug, That's not what precision medicine, because that would be too many combinations. But to categorize patients into certain categories, basic categories, and then treat them. For example, I'll just explain that with the example of breast cancer and the role of precision medicine in breast cancer. So breast cancer affects, as you know, like millions of women across the globe, all over. In India specifically, the numbers are really high, about 1.8 per year number of cases. Now, for some of those breast cancer patients, some of the therapies work better than some of them don't work. But how do you know that? That is by doing the biomarker analysis. And so based on the biomarkers, so about 70% of patients with breast cancer will benefit from a endocrine therapy, that is anti-hormonal therapy, that is known. So only those patients will get the anti-hormonal drugs rather than giving it to every woman who comes down with breast cancer. Similarly, there are other targeted drugs in breast cancer like a Herceptin antibody drug, which is only given to patients who have HER2/neu receptor on the breast tumor cells. So this is again what is precision medicine and how it helps. Now coming to the latter part of the question, which is how does it how has it helped in pandemic, right? And how will our practice change in future? So it has, I think the precision medicine has helped a lot during the pandemic. So as you know, the whole any cancer, for example, is a process where you screen the patients, you find the tumor, you do biopsy, and then you remove the tumor completely from the body, and then you decide whether to give the patient radiation, chemotherapy, etc. Now, during pandemic, what was the situation is all the hospital beds were occupied with COVID patients, and all these cancer patients are immunocompromised. So if they go into the hospital to do chemotherapy, to do screening, then they might acquire the infection themselves. So these were the issues. And how did the community solve these problems is by really choosing patients. So now whom do we screen in this patient population, whom to screen whether they have breast cancer or not. So, if we have longitudinal familial data, whether some families have run the mutation of BRCA in the family,
Right.
then help them come up for screening. Some patients who have already finished biopsy and the tumors are big, then instead of coming to hospital for operation, give them treatment before surgery to shrink the tumor. So all this is achievable by doing what's called precision medicine, and that's
absolutely. And I get the drift here, and I hope to kind of I hope the audience also understands that we are moving towards a point where what we will be looking at everybody as unique individuals.
correct.
You may have unique characteristics, and so therefore what is eventually prescribed to you is more tailored towards your uniqueness rather than towards a one size fit all kind of an approach. And that may be something that then becomes a close partnership between those that work at the bedside as clinicians, those that work in the world of assisting a good diagnosis through greater precision, and then the people who actually manufacture the drugs or produce the therapies to be able to work in tandem. And that is something that goes a long way towards correctly identifying and correctly delivering the appropriate care. However, that is still 2 steps down the line.
Mm-hmm.
It does save a lot of angst down the line for a misapplied treatment. But what if we were able to apply precision heuristics or understand who's heading in a particular direction? And this is where I will turn to Abhishek Sharma. I mean, is there a way from the world of GOQII and the kinds of data that you're picking up from people, are you able to say some are more likely to get into trouble, and so therefore here's a red flag, or here's a yellow flag, or here's a different kind of a flag that you need to kind of have so that you are avoiding that particular journey?
Hi, Bobby. Thanks for having me here. So first of all, briefly, I will explain in 2 sentences what we do. So we are a complete health ecosystem. We are not in the space of, I would say, medication. We are in the complete preventive space where we use data to help user make a behavior change towards a healthier lifestyle so that their chances of getting sick reduces. And as you rightly said, the data is very important. So I would go back one step to your previous question, is what the impact of COVID has been on the world, or the world perspective towards health, and the importance of preventive health. So it has changed two things. One, it made the people realize they have to be responsible for their own health, and have to take the preventive measures to stay healthy, because otherwise, if it's like, if your body is weak, anyone can attack you, right? Any virus, any hunger. So you have to be strong internally. Secondly, the importance of data, right? Today, if you look at it, every household since the outbreak of COVID, uh, at least have a thermometer, and some of them, even most of them, even have an oximeter, right? Because the user today, or the consumer today, is getting more and more awareness towards the importance of data and how it can be used, right? I'm sure all of us who have been the panel themselves and their extended family have been a time when we have checked our temperature multiple times during a day, was cautious about whom we are coming in contact with, checked in terms of it. So the whole impact of data tracing, contact tracing. So this is nothing but just the data. So what we do, and there has been a lot of work which has the team has done in the background, specifically for the COVID, since the outbreak, is that we accumulated a lot of data of our users. We upgraded our devices, so we do have our own variables, right? So the first device which we launched at the outbreak in April had the capability of monitoring the body temperature continuously. So we equipped our users so that they can be aware of any, I would say, fluctuation in your body temperature, right? So, because it's not that, you get a fear. So as soon as you are on the brim, your body gives an indicator. And body temperature is one indicator, because your body is fighting that virus, and try to overcome that. So body temperature. Then we upgraded our devices further so that we can enable users to get more data. We upgraded it to another device which is in the market right now, Smart Vital, which also has the capability of capturing the SpO2 level on the go, right? And what the ecosystem does is it uses all that data and give it in a very precise and clear manner to the users, so that they can be aware of what their body is going through. If there are any abnormality, the ecosystem and the platform make them aware that they are at risk. There is an alert system which is in place. We have, I would say, deployed this solution in various frontline workers like Mumbai Police, uh, Pune municipality, and a lot of others. So roughly around, I would say, 10 to 15 frontline bodies are using this solution to monitor and to be preemptive about any kind of the risk these workers or the frontline warriors get into it. Because if we are aware of the data, or the predictive analysis, as would we say, uh, coming out of the data, the more equipped we would be able to handle any kind such situations. Also, what it does is, utilizing the data and the behavior of our users, we are able to even guide, nudge, as well as make them more aware about how they can build up their immunity. Because at the end of the day, it's all about immunity. If your body immunity is strong, and I would say, thankfully, Indians have better immunity than most of the developed countries, and that's why if you see, our death rates fluctuate between around 1.5%, whereas countries even as advanced as US or UK are above 3%. So it is less of a reactive things which comes into a picture of giving a medication or doing a treatment, but also how strong internally you are. So we also work with our users through the platform and through the coaching and guidance and nudging. What we do is how they can build up their system to be stronger. So it's a combination of, I would say, the technology as well as empowering the users and using their technology, and how we work with it. So the data gives, in terms of an insight, equipped me to be more predictive, more forward looking, whereas the insights and the ecosystems or the other elements of coaching, videos, content enables them to make those changes so that they stay safe. That has been our modus operandi has been with our users, because if you look at the country like India, fortunately, we have good immunity, so that's why we are able to cope better with this thing. But unfortunately, we don't have that much of infrastructure support that if we would have a bad immune system, the infrastructure could have supported it. It's only the preventive health, I would say, is the way forward for any COVID. Because see, COVID is one of the the first viruses. If you hear the scientists all over the world, there will be a lot more to come in the future, right?
Sure.
Because all the
Mr.
mutations and
Sharma,
all the
yeah,
exposure which is happening.
Yeah, sure. I get the point. I get the point that prevention is definitely the way to go forward. And then from what Dr. Bakre had said earlier on, I mean, intervening earlier with better insight is actually the better way to go forward. I turn to Manoj Saxena while I see Ms. Pooja Bedi already on the screen. Thank you very much for joining us. Manoj Saxena, you're representing a company which is almost like a double-barrel gun. I mean, storied names. Bayer, I mean, aspirin, if anybody takes aspirin, it comes from Bayer from the 1800s, to Zydus, which is one of our storied companies here, and you've got both names attached to you. When you're hearing two people who are talking precision medicine and early preventive thing, where does that leave a company like you, albeit with something that is today talked about as magical, aspirin, for preventing many, many things? Where does that leave you, and how do you think the pharmaceutical world kind of takes in a prevention approach?
So thanks, Bobby, and thank you for having me. See, healthcare is a multi-stakeholder topic. I don't think only pharma company or doctors or diagnostic lab alone can play a part. Yeah, we all are working towards one single mission, that to give the benefit to patients. I think that's where what we exist. And over these years, Bayer has existed because of looking at innovative solutions to manage the disease well, give better quality of life. So I see moving forward also pharma industry's role remains absolutely paramount, and more so now, and you're seeing in COVID as well, at least the lay press is also being aware of the challenges which pharmaceutical research is under, it's a, now coming back to preventive health, yeah, the way I look at it, and I think this, the popular slogan since our childhood we all hear is prevention is better than cure. But I think somewhere we all feel that cure means of curing a disease, but not on complications. And I'll give example of to help you understand in terms of why prevention is important at every stage. Yeah, a diabetic patient, prevention is better than cure if he continues to manage his diabetes well, in check. He avoids complications of diabetes. So for them, prevention is better than cure. But for a healthy patient, if he manages his lifestyle, diet in a better manner, probably he can delay diabetes. But if he has both the parents diabetic, probably he will get diabetes. He can't really prevent 100% diabetes. Yeah. So I think from a understanding of prevention is better than cure is something which depends upon where do we at what point of time we are looking at prevention. Yeah. But definitely, I think any disease, and particularly for NCDs, any disease, Bobby, it's a given that the attempt of the stakeholders, and I'm very happy that the government of India is with looking at whether it is Swachh Bharat Abhiyan or now safe drinking water, or I mean the whole initiative against the health, yeah, is targeting a section of society which does not have access to a lot of things. And I think in that, focusing on setting up centers which are wellness centers where there are trained staff supporting it is extremely important. The other common slogan on health is wealth. Yeah. And I think as a society, we should now change it, saying health should be more valuable than wealth, because, and I think that's critical for us. And sometimes we just raise this slogan, but really don't think in that fashion. And the third thing which I want to say when we talk about prevention, I'll come back, let others also comment, is I think it's important to understand for health, there is no magic wand. Yeah, all the stakeholders have to come together and work together for long. And I'll give example. Yeah, anemia is a big problem in India, right? 1970s, we have this national anemia program, but the data which was published just last week of the NFHS survey number 5 the women who are suffering from anemia have risen from 49% to 57%. The child between the age of 6 months to 5 years, 70% of children are anemic. Now, I think that is where the prevention should be. How do we make people greater aware of it? Yeah, and I think giving analogy of endemic is good. Most of the people are now aware of using masks, hand sanitizer, washing their hands, social distancing. But when it comes to anemia, people may be thinking during pregnancy, okay, I should take a copper pill of iron and prevent anemia. But not many people know if they are anemic, it leads to higher chances of vital organ complications, even heart failure. And I think that is very important for health, that we have to stay invested. As a country, we are not spending enough amount of money on healthcare infrastructure. Our percentage GDP spend is very, very less. As a country, we need to make sure that we should listen to patient and make him empowered so that he can make a choice and not anyone else decides for them. So I think those are the nuggets which I think are extremely important, but we are heading in the right direction. I think the government thinking around prevention and doing a lot of stuff there.
Thank you. I mean, many interesting points there, but I want to kind of take one line because it kind of gets me a segue into to the next guest that we have. You're saying that there is no magic wand for health. And I have Pooja Bedi here, whose tagline goes, magicians of wellness. And I'll hold that for a second. But just before I ask her to speak, I mean, very interesting that you point out that it is multi-sector. It is multi-stakeholder. It is not about hospitals, doctors, clinicians, and the paraphernalia around them. Health starts a long way off before you even begin to see a hospital. And health really means you shouldn't be in the vicinity of hospitals too much. It has to be a lot more experienced at home. And how do we ensure that? We've heard from Abhishek Sharma, if we can monitor things early on, and there's a whole plethora of technologies that are available today to get physical signals in a collated fashion that allows you to say, look, there is something that is going wrong. Or should something go wrong, there are now newer technologies, as Dr. Bakre and OncoQuest have kind of shown, that it could be possible to pick up the signals much earlier, so that you're not chasing different kinds of solutions when really something else was the matter. All that tells us that you can intervene earlier, but these are not magic wands. But the magician of wellness, who dwells into the mind part of it. I mean, so far we've been kind of getting signals from the human body and trying to intervene there. I mean, how do you square this? There is no magic wand with your tagline, and how do you kind of enable mental well-being?
All right, is it me now?
Yes, that's you, Ms. Bedi.
All right. So thank you. It's wonderful being on this panel. Apologies for the delay. Wi-Fi in Goa is not the best. Having said that, I'm so happy, firstly, that we are discussing wellness in a much larger manner and on a wider platform and reaching out to so many people, because I think COVID has kind of made everybody extraordinarily aware of the importance of wellness. Now, when I speak about wellness, it is not necessarily what we call physical health. Wellness is holistic. So when you talk about wellness, you're talking about your physical wellness, you're talking about your mental wellness, you're talking about your emotional wellness, you're talking about spiritual wellness, you're talking about sexual wellness, you're talking about financial wellness, you're talking about social wellness. All of these forms of wellness fit and surround us constantly. And if any one of those aspects of wellness are dysfunctional in our lives, it leads to a dysfunctionality in our system. So when you kind of explore the entire correlation between your thoughts, your emotions, and disease, it's really astounding as to what an important role your mind plays in your disease. There's no formula. I know as a society and as human beings, we love boxes. We love these little compartments that we put everything into, and everything has to be in this particular manner. Medical world has its own place because it's validated. It's sciences that are validated. And I come from a realm which amalgamates sciences and meta-sciences. So we're not completely into what you call the energetic woo-woo sciences, so to speak, but it's a very logical, scientific look at meta-sciences and the role that we play in our entire well-being and our healing and wellness processes. So say, for example, the power of the mind in creating an emotion which then becomes stressful, and the stress then gives rise to different reactions in the body, which therefore cause disease. Now, if you research, this lady called Louise Hay, she had a book out called Heal Your Life. And in this book, it's almost every single disease alphabetically listed. Any ailment or disease or affliction that a human body, a human being could have, from acne to cancer to diabetes to heart problems, it's the works. And everything has an emotional reason as to why it triggered in the human body. It's very neatly formatted, and it's wonderful to keep an open mind, because at the end of the day, if we box ourselves, we're not opening ourselves up to greater realms. Like, for example, Ayurveda and homeopathy. We're so focused on the medical world, we're completely ignoring how incredible Ayurveda and homeopathy can be in treating COVID. You're not even allowed, unfortunately, in the world of Ayurveda and homeopathy. And I know many of my homeopaths and Ayurvedic doctors have attempted so many times to reach out to the government, but somehow internationally there's like almost a ban on speaking about how incredible Ayurveda and homeopathy can be in treating COVID. Whether it's bryonia, whether it's other medications that they're dispensing it to patients, but they can't publicly announce that these will actually arsenic album 30. Nobody's actually speaking about the fact that these are great preventive medications, and also they really help your immune system. I mean, there are so many ways to frighten people into taking a certain allopathic medication, but there's no basis by which you can actually go out there and invite people to try an alternate form of medication that can actually help them. And I think that's really unfortunate. I think when it comes to sanitizing and putting the fear of God into people, we look at the Pharma protests. There are the largest human protests in history. I mean, where's the social distancing there? You should imagine that they're all affected en masse and that they're all falling like flies en masse, but that's not the case, is it? So you have to turn around and think that there is something, there is some truth to concept of probably herd immunity. There is the concept that our bodies are so naturally tuned as Indians to be resilient to certain bacteria and certain viruses and certain strains. People come from abroad in highly sanitized countries, and they fall ill within a day or two of landing in India because the immune system can't cope, because they're so highly sanitized in their countries. In our country, we're used to the exposure. Our bodies learn to be resilient. Our bodies learn to fight back. Our greatest strength is our immunity. And basically the focus should be on building your immunity, keeping people scared, keeping people locked down, keeping them in financial distress, keeping them out of sunlight, keeping them away from exercise. These are not ways to build your immunity. These are ways to lower your immunity. So what we're doing by a lockdown is essentially causing a nation of people who are going to fall sicker and sicker. A lot of the old people in this country have suffered immensely with the lockdown. And I'd say that's largely because of the inertia, the lack of stimulation, the lack of social life, the lack of everything. Because, as the lives have no meaning after a certain age, and now you've taken away every purpose that could possibly be in their lives. So now you're talking about the old people, like my father-in-law to be, who just perished and passed away within 3 weeks of being bedridden after fracturing his femur bone, because it's so unfortunate that we've taken away life and joy and living away from an entire society because we're so focused on pharma and a vaccine, and the fear psychosis that we inflicted upon not just our nation but across the world for that matter, and that's certainly not healthy in any manner.
Thanks, Ms. Bedi. I mean, thanks. My condolences on your loss.
Thank you.
Many of us have lost very dear ones in our immediate circles or in our families or people that we know, and it's been an extremely stressful time. And I go back to where you kind of began with, that health is many things. And as I go back to the founding statements from the WHO preamble, which says health is not merely the absence of disease, but complete physical, mental, social well-being, and so social encompassing many aspects of it. But here's a couple of things that I want to kind of address the audience who are listening to us. I mean, we've had four panelists who have kind of presented their perspectives on it. One from the world of looking at how do we ensure that people get the right kind of therapies when they are in a sick situation. Earlier on, if we can get the right kind of signals from the human body by way of preventive measures that we can take, to understanding that it's not just one set of interventions that will make sense. It will be many interventions that Manoj Saxena has kind of so eloquently put it. Everybody has to work together so that things kind of are actually translating into health for individuals. And it's also a function of how much we prioritize and spend on it. And Ms. Bedi kind of getting this holistic picture that many things need to be functioning for an individual and a community to be saying that it is experiencing wellness. I just want to underscore a couple of things here for the audience, that everything that we prescribe or that we suggest as useful needs to pass the cornerstone test or the touchstone test of evidence. And that's where I come in, and from my perspective as a public health physician and policy engagement perspective, that if something is subject to evidence, and if it passes the evidence test, brilliant, that should be available. And anybody who proffers a solution needs to also be open to that scrutiny. And that's how science advances. That's how our collective well-being advances. And if we are shy of putting our solutions to the test of evidence or rigorous analysis, then we will run into difficulty. And it doesn't matter whether Bobby says it or whether Manoj Saxena says it. It has to kind of come to a thing. And so therefore, when we kind of turn around, Ms. Bedi, I'll come back to you.
Yeah.
When we kind of come back, I mean, I just want us to focus on this whole realm of people feeling well. And we've seen a spate of people who have been, over the last year, you said, for people being in lockdown, feeling like they are in a box, they're not able to think clearly. Many, unfortunately, have taken their lives, and people feeling it's all bleak. How do you begin to address that and prevent it in a country that's less on resources and more on the problem itself? How do we begin that?
I mean, I give my workshops across the country where I talk about the power of your mind, the power of positivity. I mean, I do these intensive workshops that basically help people change the way they think, right? To view the glass as half empty, half full. It's nice to just say that as a quote, but how do you actually change your headspace into seeing life differently? So I conduct these extensive workshops in such fields and enable people and empower people across various stratas of society, which I've been doing continuously through the lockdown. I just want to put something out there, which I was trying to interject a little earlier. I have nothing against the pharma companies. I think everything has its space. I think everyone must work join hands and work together.
Absolutely.
Pharma basically can, for example, if you have a cancer and you go and, you've got 4th stage cancer, it makes no sense to start at holistic level, and start to analyze why you got it, because cancer's taken over way too fast. And at that point of time, perhaps you would need to go in for a chemotherapy or multiple sessions of chemotherapy, but also lace that along with sciences that enable your body to heal faster. Right. Also, a lot of medical science, a lot of pharma deals with the symptoms of a problem, not actually the root of the problem, because in wellness, we believe that every illness and disease has a root and a seed. So no matter how many times you try to kill the cancer, it will keep recurring if you don't go back and deal with the root of it. So there has to be a certain openness of mind, even in terms of the medical industry, in viewing certain different aspects, which may be considered woo-woo, but, and not defined sciences or not validated sciences, but to keep an open mind. I mean, for example, why is it that Pfizer is touted as, wow, they're coming out with this vaccine and everyone worldwide wants to take this vaccine, when now suddenly people are having these crazy allergic reactions to it? The CEO of Pfizer himself has not taken the vaccine, and they're all these murky spaces happening there. Why aren't we equally allowed to pump up Ayurveda and homeopathy, and talk about that?
And
why is there such a dividing line, saying that we will not advocate this, we will not talk about this, we will not even try these, or the government will not even put it out there as potential cures, but we will happily do that for a Pfizer that is completely, as we can see, not giving 100% result. And even then, there's no guarantee once you have the vaccine that you'll ever not get COVID. So why are we so close-minded is what I want to know about our alternative sciences, and especially coming from India, a land that is the land of healing, nature, cure, and Ayurveda. And why are we not pursuing all of this? Why are we close-minded about it?
Dr. Manjiri, you're in the realm of precision medicine. You're in the world of delving into the minutiae of what works and what does not work, including to the fine tailoring of what is the intervention that happens. And I want to kind of jump off from where Ms. Bedi has literally thrown the challenge. I mean, why are we not kind of looking at the things that are homegrown? And why is it that that we are reluctant to go with something that is here, with a marked preference for something that's coming in from, let's put it, say, big brands and stuff like that? What's a scientist like you, how do you kind of approach it from the perspective that there is this offering and there's a perception, and we still haven't kind of squared the conundrum here?
Right. So I think it's a very complex question, and there is I by no means I belittle alternate medicine. In fact, I myself take it for certain conditions. So it does work for certain conditions, and it doesn't work for certain conditions. So as Ms. Bedi also said that if you have a stage 4 cancer, then trying to get homeopathic medicine is not going to work. What you need is like a chemotherapy which will kill all the fast growing cells, because it needs to act fast. So now, given this background, why they are not in the mainstream is also, it's a very complex, Ayurveda, for example, it's a very complex system of medicines. Each of those medications have multiple components in it. And what we don't know is today is lack of evidence. I mean, everything in allopathy is evidence based, and that's how it should be. But when you and it's very known, like there is only one imatinib compound in a tablet, and that works on patients with blood cancers. So it's very one-to-one correlation. So in Ayurveda, that has been our biggest handicap, is the standardizing of the drugs, the chemicals in such a manner that because they are the origin of the drugs is from plants. So it is complex to really narrow it down to exactly what is there, what is not there, to figure this out. And I guess that is one of the reasons why they are not so so well represented in the terminal illnesses. Although there are, for skin allergies, homeopathy does work. So in a milder diseases, yes, but in major, when it's like really life-death situations, the Ayurvedics and homeopathics are not absolutely mainstream. For, I think, mainly the basic reason is we need more evidence, which will directly link them.
Let me give you two examples. I mean, two herbal medicine examples that have saved lives and that have become pioneering and then should show us the way as to how we need to go forward. One is Chalmugra oil. Okay, many of you don't even know what that means. Comes from a tree, was the first step towards addressing leprosy and became the mainstay for anti-leprosy treatments. Okay, the other one that I kind of pick up and is today the benchmark for treating malaria comes from the Chinese herb Chingasu, which gives rise to, after a lot of work, both Chinese herbal medicine and others kind of talked about the benefits of this plant for curing malaria. But it took the pioneering work of a Nobelist to translate or to identify the active principle and translate it into artemisinin, which today becomes the mainstay for malarial treatments worldwide and has saved millions and millions of lives. And that's all we're asking. It's not about the competition between one pathy or the other. It is submit what is a potential cure to an evidence test. Let's run it. Let's identify what specifically it is. And then the magicians at companies like Zydus can actually then say, this is how we can take that plant molecule and make sure that it runs through in a standardized production format, see whether it works in trials with human beings, it is safe, it is effective, and therefore then regulators allow it a free pass. Not
So, Bobby,
without restrictions, not without restrictions, but with care, so that there is no harm. And if there is harm done, to the points that you have raised earlier on, Ms. Bedi, if there is harm done, the regulators and the environment essentially puts a brake on it and says, hey, look, wait a minute, what's happening here? And so that's where I want to kind of place
so
it.
When Pfizer has allergic reaction, shouldn't they be putting the brakes on that as well?
Sure. So let me kind of hold that for a second, and I'll come back to you because I heard Abhishek kind of jump in between. So that's within that ecosystem that we want to kind of humbly say that everything, even an early signal from a from a device like GOQII? Is it valuable? If it is valuable, can it be reproduced in every situation that it is there? How do we kind of then say that this is a life-saving device, or this is something that we need to have in more hands? That is what we would want to kind of do. Abhishek, you wanted to say something.
Yeah, thanks, Bobby. So I would like to, broaden the spectrum over here a little bit, right? At the end of the day, what we are talking about is the longevity, right? How do we live longer? How do we live healthy, right? And there has been multiple research on that. There has been the research done in Europe, on the village in Italy, where people are centurions. There has been multiple research done on how people able to live 80s and 90s and hundreds beyond, in the region of Japan, and how they have been. So it comes down to the 5 basic principles, and that's what I started before, about how can we be more preventive. So if you look at it, it comes from sleep, right? And I don't think there is less evidence today when we talk about the importance of sleep. It comes about the importance of right nutrition. It comes about the stress management, and the mental health, with Ms. Bedi is also talking about. It talks about your social behavior, right? How social you are, how interactive you are. It also comes about your cognition, right? Your mental health, your mental awareness, and that's all lead to your longevity and build up your body, right? So when we talk about the preventive health, it does not mean we are talking about taking an Ayurveda or homeopathic or an allopathy, right? These are all fields of medicine which are there to cure a particular condition. When we are talking about the population health, we are talking about how can we prevent that happening, right? Once the damage is done, let me put it that way, there can be various solutions to it. There can be from the house of Zydus or Pfizer or allopathy on this thing. But the question what we should be getting more aware about is that how do we stop it, or rather reduces the chances of happening it, right? And for that, there is enough research and enough evidence is there, right? It comes from the, all, from the Asian scripts to the latest studies done by the WHOs of the world, and, all the research saying that, these are the 5 pillars, right? You eat right, you sleep right, you keep your mind engaged, you manage your stress, and you stay socially engaged and happy, leads to a better life, because your body builds up immunity. Your body stays healthy to kind of gives you, I would say, ammunition to fight any kind of an external factor, whether it could be as deadly as cancer. If you look at the studies which have been done on what has led to the and sudden outbreak or the sudden cause of cancer in a healthy human being, the studies have shown that in the last 18 to 24 hours, the person has gone through some kind of a mental trauma, which has led to compromise of immunity, which has given, a kind of an ammunition to those cancer cells to develop.
Sure.
Right.
So
It's the end of the day. It is how you use your body. Your body is very strong. Your body is the best piece of engineering the world has. Right. What the use of data is to identify what your body is telling, right? And how, what are the areas where you're lacking, and how do you build up on that, whether it's a sleep, whether it's hydration, whether your nutritions are not right. Is that what the data adds value to it? Data on its own is not magic, right? Data, how you use that data to derive a certain results is what creates magic.
Right. So let me turn to Dr. Manjiri. I mean, you had put a slide right in the beginning, which I want to invert right now. That slide showed who should you give the right treatment to. If I have to kind of paraphrase that in a particular way, is there a way, the workflow that you have, does it also apply to a way to diagnose people who would be more likely to be in trouble? Is there that world that's also opening up right now?
Yes. So you mean holistic? So there are
or precision diagnostics or heuristics.
Yeah. So there are companies in the US. There is Foundation Medicine. There is 23andMe, and in India there is Map My Genome. So they are doing this. It's called the Map My Genome, run by Anu Acharya in Hyderabad. They do what's called Genome Patri. So they're trying to analyze your genome and trying to tell you what are the potential diseases you may get, you may not get. who are your I mean, in your family, how are you related to various people with, etc. So it basically, 23andMe does a lot more genomic analysis. Like they tell you family tree, you're related to him or her and all that. They go back. But essentially, that is a really broad and very generic level of precision medicine, one can say so, in terms of telling you in future you may come down with XYZ disease. So that is available at the general level. I mean, this is not to say will I get colon cancer or not,
Sure.
but
Sure.
it will tell you. Yeah.
And so if you have those kind of signals, and if you have physical signals that the GOQII ecosystem kind of generates for you, you're able to kind of put yourself on a risk matrix and basically say, I need to be careful. I need to be watching how much I'm sleeping, or whether I'm getting enough sleep, and the quality of sleep that I'm getting, or how much of water I'm drinking, or how much I'm putting out every day from my body. And then that kind of gives you a sense of where you might be feeling better or on a trajectory towards not being so well. Manoj, Saxena, when such things happening around in the world of precision diagnostics, a lot of data coming along, how does a company like yours, and you've got multiple divisions, you're on the buyer side of the story. I know that there is another side of your company which is right now actively engaged in getting us a new vaccine for COVID too. How do you kind of respond? How do you kind of respond to it, and what do you say prevention? How do you kind of put yourself in the prevention conversation?
See, at the end, the society looks at it, what is impacting them, right? Why do you use iPhone or Android phone? Just because it helps the user. Yeah. And I think the same is true for healthcare, whichever segment you look at it. Yeah? At the end, the patients should have the power to decide what is good for him, provided he goes to the right clinician, whether it is allopathy, Ayurveda, or anything. I think that's and it's on the regulator to decide which is the right treatment, what is the right treatment. I think what we are invested in is essentially around investing so that we have good evidence around safety and efficacy of any drug. Personalized medicine, we are invested heavily now in gene and therapy, which is the next round of looking at personalized medication diagnostic. See, there are markers, as Abhishek was saying, look at from a data point with, and if you look at any data point for diagnostic or for treatment, at the end, if somebody has diabetes and you give him a medication, how will you know whether the medication is working or not? Till you subject him for some test, whether he's taking an Ayurveda medicine, whether he's doing XYZ, and any prescription in diabetes start with first two things are exercise more. Yeah, and I think that's where the GOQII helps actually, right? Exercise more, whether the treatment is there or not there. The second is have good wholesome meal or diet, plan your diet in a manner and the third thing is whatever medications are there. Now, the critical aspects for medications are, irrespective of which medication it is it helping the patients to get back to the desired level, right? And that's where you have to undergo individual diagnostic test, simple diagnostic tests like fasting glucose, HbA1c, to a little bit trickier if the kidneys are involved, if the eyes are involved, if the liver is involved, if heart is involved. And I think those are the sort of then, any clinician will look at it, whether the drug is working or not. And as an industry across the board, I think everybody would look at it, whether this drug is effective as well as safe. And there are many mechanisms which every country's regulator, policymakers, as well as executor, dispenser has put in place to look at it. Is it working or not? And I'm sure a patient will not take a drug if after 6 months of taking a drug, his diabetes is not controlled. Yeah, if he is religious in adhering to a therapy, adhering to the diet plan, adhering to exercise. All the three are important. And I think what Pooja was also illustrating was that, yes, we have seen that, and Ikigai is a good way to look at it from a Japanese perspective. But believe it or not, our life expectancy in India is less. Our infant mortality is higher. Our maternal mortality is higher. How can we improve that? Is only looking at all the three components together, along with what are we eating, whether the anemia example, which I look at it, how much exercise are we doing to keep ourselves fit, and are we adhering to the treatment, what the right qualified healthcare practitioners have advocated to us. And pharma companies play a significant role in looking at any disease. And as we move on to the newer data, looking at what is the best for individual patients, whether it is cell and gene therapy, which I have spoken of, or any other therapy. So I think that's where the key role of research-driven companies is to invest in research so that there is enough data so that people can look at the data and see what is good for their patients. Yeah, and then the regulator looks at it. Is it good to be allowed in a country for example, for commercial usage? Yeah.
Right. So, which is where then I could have turned to Ms. Bedi, and I think she has not quite said it the way I'm going to say it, but I'm going to put words into her mouth, and then ask her to respond. Is that essentially when people want to be reassured that they are either on the path of wellness, whether it's in their mind, whether it's their body, whether it's their community, they need somebody who's assuring them that what they're saying is good, is verified and verifiable, and there is an accountability to it. Is there a body of people? Is that a service, or is that something that you would see more of? And how do you kind of, as magicians of wellness, how do you want to kind of expand that body of people who may draw on different disciplines and interventions, but are essentially giving an assurance and are also accountable for what they're kind of giving?
So once again, we come right back to exactly what I've been trying to say, is that why is it that we just blanketly give the world of allopathy a tick mark and the world of alternative science a question mark, right? So no, I'm just elaborating here. Sure. Because at the end of the day, I think when you talk about assurances and you think you're going to a doctor for assurances, the fact is, I think from research, it says that misdiagnosis is probably the third or fourth leading cause of death. Okay, worldwide. So, I mean, I don't think that going to a doctor is actually any assurance of any kind. I know many patients and many people who've gone into the medical stream, in the medical system, and been treated for, gone to operate a shoulder. The drugs given to help the pain have affected their liver. The drugs given to help their liver affected their kidneys, which then affected their lungs. And, they just said, to hell with this, got out of the hospital and just, went off to wellness to make themselves well again. Now, I mean, I know that there's a very strong role that allopathy does play in healing and helping people get better and saving lives. If you have a certain blockage in your heart, you're not going to go to wellness, you're going to go to a doctor and you're going to go get an angioplasty and you're going to get those things done. There is a role for everything. Yes, I agree. But as human beings, we have to also be aware that the system in which we live in, for example, we are surrounded by EMF, whether it's our mobile phones, whether it's microwave ovens or our televisions, we're constantly exposed to harmful radiation that will affect our body on multiple levels. Now, what are we doing therefore to counter that? When you talk about the importance of sleep, are you going to go and pop a tablet, which then may give side effects or get you addicted to it? Or are you going to go into a world of wellness where you inhale perhaps lavender essential oils, or have chamomile soothing tea that calms you and puts you into a state, or listen to perhaps alpha binaural beats to put you into a lovely meditative headspace, or perhaps meditation? So what are the options that you are choosing, in order to get better? Or do you blindly turn to the world of allopathy for answers? When we also talk about healing, and even when you talk about plant medicine for that matter, when you talk about haldi and the incredible beneficial healing powers of haldi, we also have to realize that everything has a biotope. Haldi is very medicinal in certain regions where it's grown with certain flora and fauna surrounding it that creates a certain resilience in that strain of haldi. Not all haldi has that level of medicinal power, right? So when people blindly go and eat tons of haldi thinking that it's got curcumin and is going to give them, you have to have about half a kilo of haldi to have 9 nanograms of curcumin inhaled and ingested, and mostly when it goes to the digestive tract, it's mainly flushed out. So there's a lot about wellness that needs proper researching, proper awareness as well. It's not blindly go one way or blindly go the other way. We all know, for example, as a society, I think we need to change a lot of things. We all know that smoking kills. Every packet of cigarettes has this big thing on it: smoking kills, cancer, all these horrible visuals come on these packets of cigarettes. But we won't outlaw cigarettes. At the same time, we will outlaw marijuana, which is used worldwide and being accepted for healing cancer patients and being a medicinal use. We have to really look at why we are banning certain things and allowing certain things even as a society, which talks about getting better, it talks about protecting its citizens, and at the same time, we're putting out so much misinformation and making products that are harmful available to you and products that are actually beneficial for you made illegal. So we need to really take a good look at wellness. I love what Mrinalini said. Mrinalini, was it? Who spoke about who spoke about DNA. It's amazing. I mean, I was a brand ambassador for a DNA company, and they basically tell you what it is that you could have possibly inherited in a low risk, moderate risk, and high risk, and what you can do to avoid triggering those genes in your system. So what are the different forms of eating? What are the different forms of exercise you can do to perhaps not trigger those particular genes, that particular DNA that is come down your into your body. I think those kind of sciences are fascinating because it's empowerment sciences, and more needs to be explored about sciences like that. I don't think there's enough that has been discovered about the world of wellness. I'm so glad that people are talking about wellness more and more. I'm so glad, I mean, unfortunately, due to COVID, that people are getting this incredible focus on wellness. Wellness is a $6 trillion industry growing at a 30% rate. It's a huge industry today, and people are turning to it more and more because they start seeing the healing power of all these incredible sciences. And yes, it's not a one size fits all. There are different ways to stimulate different parts of you. When we say you inherit a disease, you don't actually inherit a disease. In certain meta-sciences, you inherit the thought process that creates a disease. So say, for example, diabetes. Diabetes is, if you read Louis Hay, caused by great bitterness, a sadness. The sweetness of life has gone. Now, when you have a parent who's constantly bitter about things and bitter about life and bitter about the system or bitter about everything, your child will automatically inherit that thought process and learn to be bitter or cynical about things. You learn so much from your parents. You're not actually inheriting the disease. You're inheriting a thought process that triggers the disease. So once you start actually getting down to the details and depths of these meta sciences, you realize how incredible our minds are and how our minds are responsible for all the emotions and therefore all the physical ailments that actually trigger in our system. And sure, you can go out and treat diabetes once you reach a certain stage and you need to take these insulin shots. But how about going back to the root and saying, all right, let me change my headspace so that I can get my sugar levels down and soon be off the bloody insulin and lead a normal life, because that is
Absolutely.
possible.
And a traumatic childhood is also fairly correlated with eating disorders. And if you do have eating disorders, or if you do engage in unhealthy eating, chances are you're going to do a great deal of harm to your islet cells in the pancreas. Okay, and therefore you do get onto a trajectory of diabetes, whether the abuse in the mental space is directly correlated with diabetes is a questionable one. But whether that predisposes you towards a certain kind of behavior that then puts you onto a track for diabetes, that definitely is something that's much more on firmer ground. But what is absolutely fascinating from hearing Ms. Bedi here is this, that there is an incredible focus on wellness. You mentioned a number, 6 trillion. Nobody wants to be unwell. Nobody wants to be in a hospital. And if at all they are in a hospital, they want to get out of it as soon as possible with as little damage as possible to themselves. And that's what I believe the entire world of pharmaceutical sciences and clinical sciences are geared towards. First, do no harm or do the least possible for the situation that is in front of you. If you can avoid it, if you can pick up signals early on and steer people towards preventive behavior or mitigating behavior, all the more better, because you save 9 if you put 1 stitch in time. And so therefore, that seems to be the mantra that people seem to be taking on very, very seriously. As we go forward, I think this is only going to grow. But as it grows, I believe the amount of information, clean information that's required around what constitutes wellness and the contributory factors towards wellness will also need to be a lot more defined. We cannot have hearsay and we cannot have claims that will constitute the body of wellness. It has to be a little bit more than that. And that's my humble appeal to everyone. When you hear or when you get a WhatsApp forward saying this works, please do correlate it with other evidence. And if it does not square, do ask someone. Do write in. I mean, each of the panelists here have their websites on. They are each resources for you. Square it out with them or square it out with your healthcare provider. Square it out with somebody whom you trust, who knows this a little bit better than you. And if it passes that test, sure, go ahead and take on that prescription or that direction with care, because what works for X may not work with Y, which is what Dr. Manjiri's opening slide was. There is no universality. We may have best fit lines, but we may not have specifics for everyone. Companies, when they do clinical trials, when they do take the utmost care to devise their solutions, they try and do it so that they are fitting as many people as possible, which is why when you look at package inserts from companies, they tell you a long sheet of things that are likely to happen, but for most people, it won't happen. There may be the one odd case that happens, and for that one person, it will be a huge tragedy, and so therefore they flag it, and that's their responsibility. The regulator requires them, their own work ethic requires it. And so therefore, as we begin to wrap our conversation, let's kind of get to this point for us in the audience. Prevention is the way to go. If you can sleep well, there's no greater gift that you can have. If you can eat well, and eating well today is probably a question of being able to afford it. And that kind of opens up a whole other plethora of issues around it. Are we earning enough? Are we spending correctly? Do we have the correct information to spend our money correctly on? If we can sleep well, if we can eat well, and as importantly, if we can move around well and give our God-given bodies a little bit of the exercise it desperately requires. Sitting 8 hours on a chair isn't what our bodies was designed for. We were designed to move on 2 legs with 2 hands swinging around. If you can do that, you'll sleep well too. It's kind of a related cycle. And then therefore, you'll be in a much better frame of mind. You'll wake up smiling rather than grumpy. Even if a little bit sore with your muscles, you'll get used to it. Don't focus just on the weight. Focus on your overall well-being. And if you can smile at your neighbor, and if you can be at peace with your better half, and that does not just mean your wife, it means your husband too. Or if you can be at peace with your children and they with you, you have the beginnings of what Ms. Bedi said, a holistic worldview of well-being. Because health is not merely absence of disease in your body. Health is physical, mental, and social well-being. Many, many factors come together. Even though we have a magician of wellness with us here, as Manoj Saxena earlier on pointed out, there is no one magic wand to get to health. We may have precision tools with us, with which to tell us which path to take. Or we may have early guideposts on our journey that tell us through the GOQII system and the many such like, that these are the pitfalls to avoid and these are the bumps along the road. Take all of them seriously. And above all, take life a little bit lightly. A lightness of heart makes you go a long way further along. Thank you all to my esteemed panelists, Dr. Manjiri, Manoj Saxena, Abhishek Sharma, Pooja Bedi, for spending this hour with us. I'm sure the people who have been with us online for this conversation would have had many things to pick on. There could have been a few confusing points too, which is where I'll point you back to seek advice. And when you get good advice, stick to it. Thank you.